New South Wales continues to tackle a difficult coronavirus outbreak without locking down, even as the New South Wales government and its ministers are actually infected and put into isolation. And there are worries the cluster will have spread even to federal parliament. Gladys Berejiklian and her chief health advisor, Dr. Kerry Chant, continue to give the nation a lesson in cautious, diligent and restrained pandemic management, rather than the knee-jerk resort to what should be the last resort of major lockdowns. This comes as Singapore starts to show us the way forward in doing what we've been talking about for a year on this program, that is learning to live with the virus. Let me take you through the important developments in what's been a very busy day. First, the day started with news of 11 new infections in New South Wales. All but one of these were known contacts already in isolation. So that's good news. There are now 49 cases in this cluster, and the Premier was certainly not talking it down.
And I say, notwithstanding those circumstances, that since the pandemic has started, this is perhaps the scariest period that New South Wales is going through, and Dr. Chant and I are of equal view of that. It is a very contagious variant, but at the same time, we are at this stage comfortable that the settings that are in place are the appropriate settings, but that's so long as everybody does the right thing. Please be extra cautious.
Yes, cautious, all right. Even Berejiklian herself was tested because her Agriculture Minister, Adam Marshall, has tested positive, which has sent other politicians and journalists from the New South Wales State Parliament into isolation. Anyway, all of this has led to some hysterical media coverage, of course, and plenty of commentators pushing for a lockdown in Sydney. Essentially, those on the left and many in Victoria are desperate to see a full lockdown in Sydney because it'll make them feel better about what they've been through. If New South Wales deals with this again without a lockdown, then more people will realise the Victorians have been through a lot of pain that was unnecessary. As Dr. Chant explained today, the idea of short lockdowns is really to allow health officials to catch up.
3 days is not long enough, and I think if you look at the reasons for the 3 days, it's basically a pause where you're behind and where you've got a sudden surge of cases and you want everyone to stay in the same place, and that allows you to get any backlog of any contact tracing. It's a really important element, and we may well be in that situation. I'm not dismissing any situation, but that's the purpose of that strategy. It's to give it to a pause. We're not in that situation where we're not getting to people in terms of the contact tracing.
Let's hope they can keep up. But all this had implications in Canberra. Initially, there were fears some of the people involved in the Sydney cluster might have met with federal politicians, including Deputy Prime Minister Barnaby Joyce.
Just advised as I came into the chamber that the Deputy Prime Minister is a possible close contact from a function and is just getting medical advice as we speak.
Still, soon the timings of meetings was clarified and Barnaby Joyce took his place in question time, and Labor sought to exploit the Sydney outbreak to support its political attack.
The New South Wales COVID outbreak has grown to nearly 40 cases. There is community transmission of highly infectious COVID variants in 3 states. The New South Wales Premier says until the vast majority of our population is vaccinated, these threats will be real and ongoing. When will the Prime Minister do his 2 jobs, fix his bungled vaccine rollout and establish a safe national quarantine system?
2/3 and more, Mr Speaker, of the population over 70 who have received their first dose. Half of the population over the age of 50 has received their first dose. More than a quarter of the population aged over 16 have received that first dose. The number of Pfizer vaccine doses available will increase significantly in July and again in September and October, as has been outlined by General Fruin, who has oversight control of the vaccination program.
There we go. Look, the sooner more people are vaccinated, the better. But most of the elderly have had their first dose, as you just heard. And who would now say we should have rushed out and jabbed everyone with AstraZeneca, hey, given what we know now? Party politics is strong on this issue, as is media hysteria. And underlying it all is, of course, a very serious health issue that needs to be addressed in a rational way. So listen carefully to this important question and the answer today, a topic that is seldom addressed.
Those linked to the Bondi cluster, how many of them are showing symptoms? And of those that are showing symptoms, how ill are they?
We'd have to get the information, but I am aware that there are some hospitalised cases. Yesterday, there was no one in ICU, but that changes. So please, I haven't had the opportunity today to be updated. But we need to take COVID seriously. For many, it can be a mild illness. For some, you don't have symptoms, and hence our testing recommendation. In this context, we need, if you're asked to get tested, even if you have no symptoms, please do so. So we can provide that information in terms of ICU or hospitalisation.
This is crucial. So many infections without symptoms, so many with mild ill effects, no one in this country in intensive care, a small number in hospital, mainly as a precaution, I understand. Of course, this could all change and we shouldn't be complacent. But again, this is good news, the encouraging news that most of the media doesn't want to share with you. With most of the vulnerable vaccinated, we should be well on the way to putting lockdowns, border closures, travel restrictions and all the rest of this behind us. Now, this has been crystallised beautifully today by 3 ministers in the Singapore government. Writing in the Straits Times under the heading Living Normally with COVID-19, task force ministers on how Singapore is drawing a roadmap for new normal, the ministers say the bad news is that COVID-19 may never go away. The good news is that it is possible to live normally with it in our midst. Now, they then go on to make points about high vaccination levels being key, as well as treatments which have already improved markedly, and they suggest that soon people could recover from the virus at home because after vaccination symptoms are so mild, and that widespread testing won't be necessary and restrictions can be eased. And they make the point that instead of monitoring COVID-19 infection numbers every day, they're going to focus on the outcomes. How many people fall very sick? How many are in intensive care? How many need to be intubated for oxygen? And so on. Yeah, this is what matters. How many people are sick, not how many infections there are. Australia too must be aiming to accelerate our path to this kind of normal. Instead of that, at the moment, we've got a paranoid nation slamming borders shut, restricting freedoms, playing politics and indulging in media frenzies and witch hunts when very few, if any, people right now, the good news is, right now, are actually seriously ill. That's another reason that Berejiklian and Chant really have to quell this outbreak without a lockdown. Because if they don't, the bedwetters and panic merchants will continue to run unchecked.